Hello, everybody, and welcome this evening to this Tutor to You revision live stream. This evening, we are looking at the Component 3 exam, and we're going to be specifically looking at revising explain questions. There are approximately 9 explain questions in the exam that you are going to encounter, so it's really important that you know how to tackle these. So my name is Lynn, and I'm going to be one of your facilitators this evening, and I'm joined by my colleague Laura. Hi, Laura.
Hiya.
Hi, everyone. So let's get started, shall we? So we're going to be focusing on explain questions, component 3, and just a little summary about explain questions and what you need to think about. These are worth 2 or 4 marks. You will see them pop up across the whole of the paper. Okay, so explain questions is the command word that precedes the question that you're going to read. And explain questions are used to test your knowledge of lots of different things across the paper. So you'll be asked explain questions in relation to positive or negative effects of factors on health and well-being. So they're all the factors that you've been revising, your physical factors, your social, your lifestyle, those kind of things. You'll then be looking at explain questions in terms of the impact of life events on PI's health and well-being. Explain questions are also used when looking at physiological indicators and what they actually suggest about current physical health or actually potential risks to long-term physical health. Explain questions are also used for those lifestyle choices. So there's things like poor diet choices or lack of exercise, smoking, alcohol, and how they determine physical health. Explain are also used for formal and informal support for improving health and well-being. And finally, this evening, we're going to look at explain questions for barriers and obstacles to improving health and well-being. Okay, so unlike last week where we looked at state and identify questions, which were quite short, accurate answers, with your explain questions, you need to make sure you're writing in full sentences, and you need to make a point and then you need to explain it. So you need to ensure that you're explaining how or why something is happening. Okay, so you do need to be writing more in your answers for these types of questions. So let's start revising then. Let's go on to the next one. Okay, so our first area that we're going to look at this evening is the positive or negative effects of factors on health and well-being. Okay, so Laura, I might get you to do this first one.
Yeah, of course. So we're going to do explain threes this time. So explain 3 effects that having an inherited condition can have on health and well-being. So for starters, this is testing what can you remember about inherited conditions to begin with, and then how it can affect someone's health and well-being. So have a go at that. I think you've got 30 seconds on the clock.
Let's take it away. So just pop in the chat any ideas you've got. So you could give us some inherited conditions if you know them, and then for that extra mark, how do they have an effect on health and well-being? Who's going to be brave and write in our chat? I'm sure we've got some people from last week as well who are really good, really active.
We have. It looks like we've got Lisa Lee again.
Hi, Lisa. So I think we might be a quiet bunch to start with, or it might be taking a while for people's comments to come through. So we're going to think about different types of inherited conditions. There are a couple that are mentioned on the specification. Lisa, you've written one in the chat for us, haven't you? So you've talked about cystic fibrosis. That's a really good example of a inherited condition. And that's a condition that you've inherited from your parents, okay? And Lisa, you've talked about how it can affect your immune system, so you can get infections. Yeah, so cystic fibrosis can compromise or lower your immune system, can't it? So that you're more susceptible to things like colds, any sort of infections, really, respiratory infections, which could make you more susceptible to becoming unwell. Okay, let's have a little look at our
as well. It's a sorry to put you off, Lynn. It's a really good one to revise actually, because there's lots of films about people with cystic fibrosis, books. There's so much you could do there for revision as well.
Yeah, that's a really good point, actually. Okay, should we have a little look? Yeah, go take it away, Laura.
Tell us what we've got. So the first one we've got sickle cell anemia can cause pain. So that is how you get your first mark. Okay, because the sickle-shaped red blood cells get stuck in the blood vessel, so they can't travel anywhere. Second one, having cystic fibrosis can make you more likely to get infections because the extra mucus in the lungs supports bacteria. And then the last one, you may increase your knowledge and skills as you will need to learn how to manage your condition yourself, which is a really interesting one because with a lot of inherited conditions, once someone is diagnosed with it, they're going to get a lot of information from the doctors, from specialists, that you're going to need to know how is this going to make a difference in your life.
Yeah, absolutely. And if you just note there on the screen as well, in terms of how the marks are awarded here, the answer's here that a student has made a point and then they've explained it. So they've said something about the impact on health and well-being, and then they've explained why the inherited condition is causing that. So that's really important that you make sure you think, where am I going to get my 2 marks from? Okay, so make a point, but then explain it. What is it about the inherited condition that causes that? Okay, brilliant. Okay. Let's go on to our next one then. So get everybody warmed up. Please join us in the chat. This might be a slightly easier one. So which of the following are negative effects? Make sure you read the question carefully always. So which are negative effects that could result from environmental factors? So in the chat this evening, you could just write A1 or B2 or C3 or whatever you think the answer is, write in the chat. So which ones, there's more than one, I'll give you that clue, are negative effects that could result from environmental factors. Okay, so we know that those environmental factors are things related to maybe housing condition, housing location, anything to do with pollution. So what do you think? Can you see any on there that might be negative effects from environmental factors? Let's have a little look.
And remember, in the exam, you could always go in with a highlighter and highlight those keywords in the question, making sure you're picking out negatives.
Yeah, absolutely. Absolutely. What would, Laura, which one would you pick out? You start us off. Which one of those would you say would be a good example of a negative effect?
Definitely B1. So they're respiratory illnesses due to air pollution from local roads and factories. Like you said, pollution. It's a super simple one. We know it's an environmental factor. And having a respiratory illness is never good.
No, absolutely. So it's very much a negative effect, isn't it? And I can also see A1 is also to do with light pollution. So experiencing sleepless nights due to light pollution. So we've got two there that are negative effects. We know that pollution is an environmental factor. Okay, shall we see if we can see any more?
Us a few. Yeah.
Oh, yeah,
and
go
Chelsea
for it.
is joining us as well.
Okay, let's see what they've given. So, Lisa, you've also mentioned B2 being at risk of an accident due to poorly maintained housing. Brilliant. So that's housing condition, isn't it? So if you've got poorly maintained house, might be more risk of an accident, like a window breaking, for example. Chelsea, you've given us 1A and 1B, which is brilliant. You've also given us 2B, which Lisa did, and you've given us 3A. So anxiety over your safety due to living in an area with a high crime rate. Yes, that's brilliant. So that's housing location, isn't it? So you need to be able to remember the different aspects of environmental factors, but you also need to be able to explain how they can affect health and well-being. And we've got some really nice examples here, haven't we? If we bring up the answers on the screen, you'll see that these are all examples of negative effects. So this is the type of answer that you could be giving, couldn't you? You could make a point and then you could explain it. So you might feel stressed, and that could be one effect on your health and well-being. Why is that? Because of environmental factor, because your flat is overcrowded and you must share a room. So make a point and explain it. Really get used to doing that in your explain questions. Okay, so brilliant. Thanks, Lisa and Chelsea. Let's have a look at our next revision one. Over to you then, Laura.
Okay, so we're looking at the impact of life events on our pies. So here we've got a bit of a tug of war. So we're looking at which of these answers, which is the best one? What do we think? Let's have a look.
I quite like this activity, actually. It's quite good.
So the question is, explain one negative effect that redundancy could have on an individual's health and well-being. Now, redundancy is one that I know a lot of students struggle with. They struggle to remember what this word means. Okay. And one way that I've been trying to get my students to remember what it is thinking about Charlie and the Chocolate Factory. And thinking about the way that their dad loses his job because he's not needed anymore because they've got machines. So we need to think about what redundancy is. We need to think about the negatives. So the first answer, they might worry about being made redundant. And then the second answer, their self-esteem might get lower because they no longer have a job, which is considered to make someone more valuable. Can't read tonight.
Yeah. So which one's best? We are getting a lot of B's in the chat here. So their self-esteem might get lower because they no longer have a job, which is considered to make someone more valuable. Okay, brilliant. Should we see what our answer was? Let's have a look. It's B. Fabulous. Yes, absolutely. And just before we read out the our explanation for that, Lily's written in the chat B, as they've used the because in an explain question. So that's nice, isn't it? You can use that connective word because it can then really help you go on to explain your point. So I like that, Lily. Thank you.
Yeah, and we're saying so worry would get you 1 mark, but there's no explanation there. But then the second one, as Lily said, it has that because in it. And I think definitely have a bank of some of those words you can use for your explain questions. That's really going to help you when you're revising.
Yeah, absolutely. So just need a little bit more depth to your answers. That's the key thing to remember. Okay, let's have a look at this one then. Which answer is best? Similar idea. And our question is, explain one negative effect that bereavement could have on an individual's health and well-being. So we've had redundancy, that's a life event, isn't it? And now we've got bereavement, so losing somebody that's close to you. So what's the negative effect? Well, we've either got they will be grieving because someone close to them has died and this will be difficult to deal with, or they will feel sad because bereavement makes you sad. What have we got? Chelsea and Dami are both saying A. Yeah, absolutely.
Yeah,
P&M,
I think we're in agreement.
Yeah, A, absolutely. So you're getting the point because it's a good explanation of a negative effect. They will be grieving. So that's the effect on health and well-being. And the reason for that, is because somebody close to them has died and this will be difficult to deal with. Absolutely. The B, you'd actually get 1 mark for sad, but there's no decent explanation because they've just repeated themselves. Okay. All right, brilliant. Let's move on. Well done. Over to you, Laura.
Yeah, let's have a look. So explain one positive effect that exclusion from school could have on an individual's health and well-being. So again, another life event. We've got A, they'll miss their friends, which will make them sad. Or B, you could feel hopeful about the future, as this could be an opportunity to make better decisions and learn in a different place that suits you better. So Chelsea's straight off with her answer. Let's see what everyone else thinks.
Yeah, P&M is B as well. Absolutely. They've obviously read the question correctly because it says positive effects. Yeah. So you really need to make sure you're underlining those key words in the question so that you don't make any silly mistakes like A have written a negative effect, haven't they? So we want to go with B. Yeah, absolutely.
Yeah,
so
there we go.
Don't get muddled with your positive or negative. If it just says effect in the question, you can write about either. You can write about positive or negative. But if it specifies, underline it so then you make sure you write it correctly. Okay, brilliant. Okay, so let's move on then. So also in explain questions, so we've seen that they've been used in factors and life events. So we're moving on through to the paper now. We're getting up to about question 11, I think now. So what physiological indicators suggest about current physical health or potential risks to long-term physical health? So we've got those physiological indicators, which are your BMI, your blood pressure, your resting heart rate, and recovery after exercise of your heart rate as well. And what do they suggest then about how our current health is and how our health might be in the future? Okay, so let's have a little look at how we might use that kind of information. So you're going to have 60 seconds to separate the physical health impacts of high blood pressure into 2 categories. Okay, so on the right, you've got lots of effects of high blood pressure, but we want you to tell us which of those are current and which of those are potential future risks. Okay, so in the chat, you could just write current and then give me your numbers, and then just write future and give me the numbers. I hope that makes sense. And you've got 60 seconds. So which are current, which are future? Have a go. This is a really good one to revise, isn't it, Laura? Really good.
Oh, absolutely.
Yeah. So right, current, and then give me some answers. Chelsea's brilliant. She's straight in there with current.
Well,
Chelsea, can you tell us the future? The numbers? Well done, Lily. Lily is super quick at typing, I think.
yeah, Lisa's doing well as well.
Anyone can give me the future, or are you just going to tell me that they're the ones that you've got left? You probably are, aren't you? Yeah, absolutely. So it's really important you read. Oh, well done. Thank you, Chelsea. Yeah, so it's really important in your exam that you are reading the question to see whether it says current physical health or future. Okay, lots of students get muddled up. So current are the things that are happening to you now. How is your body responding to high blood pressure sort of currently? And that's going to be different to what might happen to you a year or a couple of years down the line. Okay, so currently I'm going to go with Lily. So Lily has told us if you've got high blood pressure, you might have severe headaches, dizziness, palpitations, and blurred vision. Okay, and in the future, Chelsea's telling me that you might be susceptible to heart disease, kidney disease, a heart attack, and a stroke. So that's brilliant, guys. So make sure you know which ones are current and which ones are future, and just put yourself in the place of the individual and think, right, if I've got high blood pressure, how am I feeling? Yeah, how am I feeling physically? That's what the question's focused on, your physical feelings, and then what might happen to me further down the road. Okay, so make sure you're really clear on that and you read the question carefully. I can't stress that enough, and underline those keywords. Okay, let's look at our next one. Well done, everyone, on that one. That was great. Hey, round of applause. Excellent.
Okay, so now we're going to give you 60 seconds to match the current symptom or the future health risk of high blood pressure to the correct explanation. Okay, so we're matching letters with numbers, which you will see in a second. Here we go. So we'll give you 60 seconds for this one.
Brilliant. Let's take it away. And even if you're not sure on all of them, just tell us the ones that you do know.
Yeah, and have a good guess as well. If you think but you're not 100% sure.
Yeah, Lisa's in straight in with one. Do you agree with Lisa, everybody? Lily, well done. Yep, Lily's in agreement. Excellent.
Yeah, P&M, I completely agree with that one.
Yeah, brilliant. So what have we got? A few people have gone for palpitations, haven't they? So palpitations is one of those words that you've heard of, but you think, oh, what actually is it? Well, Lisa and Lily are telling us that palpitations are when your blood pressure is elevated, your heart is working harder to pump blood, so it can result in irregular heartbeats or palpitations. So it's your heartbeat sort of working irregularly that can make you feel a bit funny. So yes, absolutely, regular heartbeat there happening. Chelsea's come in brilliant, and Dami, well done. So Chelsea said A4 for palpitations, B3 for blurred vision. So that's when you can't see very well because blood pressure is exerting that pressure on your eyes, isn't it? So your vision is becoming blurred. C2 is heart attack. So this is really good one to know the description of, really. If you have high blood pressure, it can damage your arteries and it can also narrow them, which can restrict the blood flow to the heart, can't it? And then that, because your blood's not getting to your heart, you can have a heart attack, okay? Because your heart muscle doesn't have that blood flow going to it. Your stroke is very much similar. You're not getting blood through to the brain, really. So if you've got your arteries are all clogged up with fatty deposits, for example, you might have a blood clot. And then if that blood clot travels to the brain, then again, you can have a stroke. So in the similar way that a heart attack is not enough blood going to your heart, a stroke is not enough blood getting through to your brain tissue. Okay. And finally, well done if you said this one, E5, kidney disease, is that over the long term, your blood pressure can constrict and narrow the blood vessels in the kidneys, okay, which can reduce blood flow and stop the kidneys from working well. So there's quite a consistency there in terms of description that blood can't flow to the places it needs to flow, and therefore you can be at risk of these long-term things. So yeah, make sure you sort of know what is the cause of a lot of these long-term conditions, because that can really help you with these explain questions for the physiological indicators. So excellent. Well done, everyone. It's really good. Yay. Okay.
So for this one, sorry, Lynn. Go on, you can do this one.
No, you go. You go. I think I jumped into you a minute ago. So you go.
All right. So you've got 60 seconds on this one to separate the physical health impacts of obese BMI, into these two categories. So are they impacts on current or are they future? So very similar to what we've done before. Let's see if you can work out where these ones go.
Let's see how quick everybody can be. Surely everyone's got the idea now from the one before.
It's a shame we can't send out virtual prizes.
I know, yes, it's a shame. Yeah, absolutely. We'll give you a shout out though if you get them correct. So I think Chelsea was pretty quick last time, and so was Dami. So what are you going to put? Just Lily. Well done, Lily.
Well done.
Brilliant. So Lily straight in with the current. Excellent. And I think P&M agrees with you.
Lisa's got a couple as well. Oh, brilliant. We've all done really well then, for those of you that have been typing. So what are we thinking, Lynn? What's everyone saying?
Yeah, so everybody is telling me for current, we're going to go for sleep apnea. Okay, which is sort of when you stop breathing because of the pressure and the weight on your mainly on your sort of lungs while you're asleep, and can lead to just sort of links in there with shortness of breath, joint pain and fatigue. We've got for our current, and then for our future, type 2 diabetes, cancer, stroke, and heart disease. So excellent. Well done, everybody. I think you've got the idea then. Yeah. So we have 60 seconds now to match the current symptom or the future to the correct explanation, just like we did before. And I've just given you a few hints there. So take it away, 60 seconds. Which one relates to which? And if you're not sure on all of them, just do the ones that you can. So who's going to give us some
suspense?
Yeah, I know, the suspense. Everyone's typing away, and we're waiting to see what's going to pop up. Come on, guys, we've only got 5 minutes to go. Lisa's in there. Brilliant.
Got on.
So let's have a little look. Anyone joining Lisa? Yep, Chelsea is, and Lily. Brilliant. Okay, so Lily, well done. B3, you went for joint pain. When a person has increased mass, it puts additional strain on the joints, leading to pain. Yeah, absolutely. We flipped them now so you can see, actually. Sleep apnea, we talked a bit about that, didn't we? The extra fat around the neck, that can obstruct the airway, and then that can cause you to regularly stop breathing whilst you're asleep. It can disturb your sleep as well. Joint pain, we've talked about. Type 2 diabetes, did you guys get that correct? Yes. Obesity can cause insulin resistance, which means that the body cannot use the insulin as it should, so blood sugar levels can increase, and that leads to your type 2 diabetes. Your cancer, so having obese BMI can actually lead to cancer. Too much body fat can cause level of growth hormones to rise, which tells cells to divide more often, and then that raises the chance of cancer cells developing. And then stroke, finally, obesity can increase the risk of fatty deposits in the artery. We've talked about that before, haven't we? Which encourages blood clots, which can break off and travel to the brain and cause stroke. So some of these points, they are relevant in relation to blood pressure and in relation to BMI, aren't they? In terms of the dangers with things like such as a stroke. So these are the more tricky questions, I'd say, Laura, in the exam, aren't they?
Oh, definitely.
Trying to explain, the consequences of, negative readings, really, when you have high blood pressure or you have a high BMI. So, spend a bit of time revising this, and then you should be able to pick up the points. And remember, do as much explanation as you can on these. Write as much as you can, because often then you can pick up the marks. Okay, let's keep going.
Got a bit of extra time. If you think you finished early, go back. If need be, add a little bit more in just to make sure you're definitely going to get all of the marks available.
Yeah, absolutely, especially with these explain questions. Right, let's move on to our next question, if we can. I don't know whether we've got a bit stuck. Yep, we're good. We were just busy giving you a round of applause there.
Absolutely.
Okay, over to you, Laura.
So we're going to look at how lifestyle choices determine physical health. So let's have a look. So we've got a podium finish here. So you're going to be presented with 3 answers to this question. And the question is, explain how consuming excessive amounts of alcohol could increase Denny's BMI. You must rank them and decide which explanation is the winner and give a justification for your decision. So a little bit like when we did the 1 and the 2 of which one's the best, we're just going to rank them now and see which one we'd put top. So let's have a look. So we've got A, excessive amounts of alcohol will be making him put on weight. B, alcohol contains calories. C, alcohol is high in calories, so drinking too much of it will likely mean Denny has an excess of calories he'll not burn off. So this will be stored as fat in the body, increasing his body mass. So what do we think? I would maybe start off, is there a clear best one? Is there a clear bottom one? What order would you put these in?
Yep. So just pop in there. Oh, brilliant. Straight off the mark then here. Yep. Laura, we've got Lily has gone for B being the worst, A being second, and C being 1. Absolutely brilliant. And I think Chelsea has done the same. Yeah, absolutely. Let's have a little look. Yeah, brilliant. So there's just a lot more explanation there, isn't there? Saying what is it about alcohol that will then cause them to increase the weight. So brilliant. Okay, let's move on to our next one. Excellent. Oh, hi, Freya. Don't worry for being late. We're still going to got a few more activities to do. And you can watch this again on the YouTube channel for Tutor to You, and you can download the PowerPoint as well. So which one do you think is the best here then on the podium? What are you going to put at number 1? The question is, explain how being a regular smoker could increase Sammy's risk of disease. Okay, so if you're a regular smoker, which of these is the best explanation for increasing Sammy's risk of disease? Smoking damages the arteries, so Sammy will have problems. That word problems feels a bit vague to me. Smoking increases the risk of heart disease because it damages the heart arteries, making them stiffer and narrower over time. I'm liking that. That's really nice. And smoking is bad for your health, so smoking will make Dammy suffer with diseases. We have got Chelsea and Lily are great at this one. So what did you go for? Lily, you said B is the best. Yeah, and you're absolutely right. So we've got a nice, clear explanation there that smoking increases the risk of heart disease. Okay, so I'm going to give 1 for that. And then I'm going to give 2 because it damages the arteries, making them stiffer and narrower over time.
We've got that word in again. We've got that because.
Yeah, so actually that's really nice, isn't it? It's linking, so you're being able to do that nice explanation. Okay, excellent. Let's move on then to our next activity. This is focused on formal and informal support for improving health and well-being. Okay, so this is 16B question in the exam. So let's have a little look. We are going to shake on some seasoning to the end of this statement to make it a full answer. Okay, so the question is, explain one way that formal support could improve the health and well-being of a smoker. Okay, so you're focused on that word way. What is the way that formal support could improve? Okay, so we've got a stop smoking advisor can provide evidence-based information. Okay, so that's a way because they could provide evidence-based information. But then how could that improve the health and well-being of a smoker? So what's good about evidence-based information? Can anybody tell me in the chat? How does evidence-based information improve the health and well-being of a smoker? This might take people a second or two just to pop something in the chat. So evidence-based information is information that's been researched. Okay. Lily, oh, brilliant. So yes, so Chelsea's got to influence them. to stop smoking. And Lily's got, so the smoker can contain knowledge on smoking to make them realize how bad smoking is. And Lisa said, because it's a successful method. Brilliant. Well, I quite like Lily. I quite like yours because evidence-based information can mean that you gain knowledge and then you realize how bad smoking is, which then makes you stop. So I really like that. So let's have a look what we did. We shaked some seasoning, and we've got, which increases successful attempts to quit because it's based on what's proven to work. Yes, totally. I want information that's going to help me out, don't I? Okay, let's have a quick look. We're running slightly over time. We'll just nip through this next one. So what about this one? Explain one way that formal support could improve the health and well-being of someone who is physically inactive. Okay, so we've got a physiotherapist could provide an exercise plan. So tell me in the chat, what's good about an exercise plan? Why is that going to improve the health and well-being of someone who's physically active? What's good about it? So the way we've got here is the exercise plan, which is great. But then to get our second mark, how does that then improve the health and well-being of somebody? Just give you a second in the chat to tell me, do we like exercise plans? What's good about them? Why are they going to improve my health and well-being? I think I might say I like an exercise plan because it might increase my motivation to be able to get out there and be physically active. Lily said,
couple.
"Oh yeah, go on."
Who have we got? So Lily said, so the person can start to exercise each week in order to lose weight and prevent them from becoming obese. Nice. Chelsea said to keep them more active, meaning them they are physically more active. Chelsea
we just need Sorry, I was just going to say on Chelsea's, you've just got to be careful that you don't use the question in your answer. So try and kind of use wording outside of the question to help your explanation.
Oh, I like Dammy. Dammy's put to guide their routine and help them exercise more. I like the guide their routine. I think that's a good one.
I really like that. Next? And P&Ms have talked about similar and keep them on routine, and it will be specific for them. That's really good. Yeah. So make a point and explain it. Okay. So remember, the way is the exercise plan, and how that can improve is that it's safe and achievable for the individual, making them more likely to succeed. So excellent. Well done, everyone. Okay, let's just move on to our last one we've got for here. So explain one way that informal support could improve the health and well-being with someone with a poor diet. Okay, so friends could get involved in eating healthier, balanced meals with them. Okay, and shall we just reveal this one? I think.
Yeah, let's have a look.
About time, so we'll just have a little look. If your friends get involved in eating healthier meals, because this is informal support, isn't it, would give them the motivation to try and stick to a new way of eating. And Lily said, which will make them feel more included, okay, and want them to eat more. So the word motivation is quite a good one, isn't it? When you've got people supporting you, it can increase your motivation. So that's quite a nice thing to include. Okay, excellent. So our last activity for this evening, over to you, Laura, is barriers and obstacles.
So we've got 60 seconds to match the barrier or the obstacle to the correct explanation. So like we've done before, the letters and the numbers matching up. So we've got a service is short-staffed, women-only swimming lessons in working hours only, juggling a job and caring responsibilities, living alone in an unfamiliar place, and having low self-esteem.
So there are barriers and obstacles. 60 seconds. Which is the correct description on the right-hand side? What do you reckon? You can just put A2, or C4 or whatever in the chat, whatever works. So I'm going to have a go at doing this while we're waiting. Okay, anyone want to give us a couple in the chat which ones are barriers, which ones are obstacles.
Lily's thinking B5.
Okay. Nice. Yes. So let's have a look then. Shall we reveal our answers? So B5, well done, Lily. Yeah, so women only swimming lessons in working hours only. This is a barrier to women that work but prefer same-sex classes. They won't be able to attend physical activity designed to them, which is really good. We've also got Lily, E5.
Yeah. No, E4, she said.
Oh, sorry, E4. So having low self-esteem, that's a psychological obstacle which the individual may expect themselves to fail or think they're not good enough to take on the challenge and improving the health and well-being. Brilliant. So make sure with your barriers and obstacles, when it's an explain question, you're looking at the case study information and you're using that to guide which barriers or obstacles you talk about. And you also need to describe the barrier well, but then you need to obviously be explaining how it can impact on the person accessing their health and social care services or improving their health and well-being, obviously depending on the question. Oh, well done, Emma. She's just come in right at the end and just given us all the answers. So well done, Emma. That's excellent. So brilliant, guys. Well done. Such great participation this evening. So you can absolutely watch. Yeah, you can watch these back. They're available for you. We've just posted the link there for you in the chat. You can watch all future and past ones. Next week will be, are we here next week? I think we might be having a break and then we're here the week after, aren't we? Just before your exam, and we're going to be doing those longer discuss questions. Okay, but do watch back last week's, which was on identify and state. And thanks everyone for joining us. Have a good evening.
Bye.
Well